Now I'm pregnant. What are my genetic testing options? I'm Dr. Felix Cohen from Cohen Medical Practice. So this is a follow-up from my previous video in which we talked about preconception genetic testing. Once you are pregnant, you can do those preconception genetic carrier screening tests again, and as well if you have not done it. You do not need to repeat it if you've already done it and your sexual partner has already done it. It's not necessary. However, now we want to focus on the pregnancy and understanding the genetic makeup of the pregnancy. So there is a test that we call NIPT, and that looks at the genetic makeup of the actual pregnancy. The earliest we can do that test is at 9 weeks. It's a blood draw that we take from the female carrying the pregnancy, and we isolate the fetal cells from that blood. And we're able to figure out if the 3 of the most common abnormalities are present in that pregnancy, which is trisomy 13, 18, and trisomy 21, known as Down syndrome. We're also able to assess the gender of the pregnancy if that's important for you. It's not something that we specifically worry about, but there are some genetic abnormalities that are impacting the gender genes specifically. So we just have to look at that. And if you want to know the gender of the pregnancy, that is something the doctor can release to you as per your request. If there are some genetic abnormalities that are incompatible with a successful pregnancy, your doctor will counsel you about the next steps and what you could or should do at that point. Further than that, there are confirmation testing that we can do further into the pregnancy, starting around 10 to 12 weeks, which is CVS sampling, and that specifically checks the entire genetic makeup of the pregnancy. It's a little bit higher risk, so we try to wait off and do something very commonly known as amniocentesis, and that will occur at around 14 to 16 weeks, in which we just take the fluid from around the baby under ultrasound guidance, and we send that to the laboratory to also understand the full genetic makeup of the pregnancy. And that helps us to make decisions from very difficult chromosomal abnormalities to very minor chromosomal abnormalities that you may have found when you did that preconception test. And that can again help you and your partner and your doctor make an educated decision about what should be done with the pregnancy while you're pregnant, and then afterwards, once you deliver, it will give you that much more information and make you more prepared to help your baby once the baby is born.